The structure of cephalosporins contains a dihydrothiourine ring, which is a 6-membered ring. It also contains a beta-lactam ring, which is also known as azitidine ring. It contains an acetoxy-methyl side chain at 3rd position and an amino acyl side chain at 7th position. Sites of major alterations in the structure of cephalosporins. The first is the 7 acyl amino substituents. The second is the modification in the C3 substitution. The third is the C7 alpha substitutions. This is the C7 alpha substitution. And the fourth is the beta-lactam ring, the modification in the beta-lactam ring. So these are the 4 major sites of alterations, and one by one we will discuss all. Coming to the first, that is the 7 acyl amino substitutions. Acylation of the amino group generally increases the potency against the gram-positive bacteria, but decreases the potency against the gram-negative bacteria. When the substituent in the form of the acyl group is derived from the carboxylic acid, then the potency increases against the gram-positive bacteria. The substitution of the aromatic ring increases the lipophilicity, which increases the action against the gram-positive bacteria. For example, the substitution of the aromatic ring and the phenyl ring. The phenyl ring in the side chain can be replaced with other heterocyclics with improved spectrum of activity and the pharmacokinetic properties. For example, the thiophene, tetrazole, furon, pyridine and aminothiazoles are the heterocyclic rings which can improve the spectrum of activity and the pharmacokinetic properties of the cephalosporins. Coming to the next, that is the modification in the C3 substitutions. The pharmacokinetic and the pharmacodynamics depends on the C3 substitutions in the structure of the cephalosporins. The modifications of C3 by the ester and the amide reduces the degradation, having greater activity against the gram-positive bacteria. For example, the cefuroxime. Replacement of the acetoxy-methyl group results in good oral absorption. For example, in cephalexin there is the methyl group, in the cefaclor there is the chlorine group, and in the cefixime there is the vinyl group, and all of these groups when replaced with the acetoxy-methyl group at 3rd position can result in the good oral absorption. Coming to the next, that is the C7 alpha substitutions. The introduction of the C7 alpha OCH3 group shows higher resistance to the hydrolysis by beta-lactamases. For example, cephamycins. These cephamycins have a methoxy group, that is OCH3 group at 7 alpha position, were highly stable against the hydrolysis by the beta-lactamase. Coming to the next, that is the modification in the beta-lactam ring. In the beta-lactam ring, the replacement of sulfur with oxygen leads to the oxacephene. This sulfur when replaced with oxygen can leads to the formation of oxacephene, and these oxacephene have increased antibacterial activity. Secondly, the replacement of sulfur with carbon atom or the CH2 atom results in the carbacephene. This is the carbacephene in which the sulfur is replaced with carbon. and these carbazepines has greater chemical stability and a longer half-life. Then the oxidation of sulfur to the SO greatly decreases the antibacterial activity. Oxidation can greatly decreases the antibacterial activity. Along with this, the carboxylate group at the 4th position in the cephim ring can be converted to ester to increase the bioavailability of the oral administration. Along with this, the double bond between the C3 and C4 position is essential for the activity.